January 31st, 2015, we're here at one of my oxidation workshops. This is Dr. Ron. Where'd you come from?
Redondo Beach.
Okay. And you've got a neck problem, right?
Yes, I do.
And you've been shot up with steroids already, right? Which you weren't happy with because he didn't tell you, right?
Exactly. Yes, sir.
And what do they say your problem is?
Well, the MRI showed stenosis laterally, C4, 5, and 6, and some protrusions in 5 and
discs.
6. Yes.
All right, bend your head back. Let's come over this way and bend it down. Okay, now turn your head to the right. Limited. Turn it to the left. Limited. Thank you. I have your permission to video this?
Yes.
And post it, right?
Yes.
Thank you. And we just did your treatment. We haven't checked your range of motion yet. How do you feel?
It's a little tight in the neck, a little soreness, muscle pain on the left side.
But I didn't do your treatment this time, but I guided somebody's hand, correct?
Yes, that's correct.
All right, let's see what happens. Bend your head down, please. You can touch your chin to your chest. Bend your head all the way back, please. What did I hear?
That's better. Yeah.
Did I hear a wow?
Yeah, wow. Yes. Side to side.
Let's see you turn your head to the right, please. As far as you can.
That's it.
Okay, go to the other side. That's significantly better, okay? That side's better. Would you agree?
Yes.
Okay. So this is just the first treatment, and we know that you've got significant problems in your neck, correct?
Oh, absolutely.
You've got degenerative disc protrusions, right? And
Yes.
you've got stenosis at several levels.
Correct.
You got at least 2 discs and stenosis at several levels, and in a single treatment, you got a significant improvement in left rotation and a dramatic improvement in extension.
Absolutely. Yeah, it feels. Yeah, there was a lot of pain just turning the head before, which actually.
Oh, look at that! He's getting.
better already.
It's content.
Can we test his kinesiology on it?
All right, he's got a smile on his face, so it's getting better as we speak, right?
It is.
Oh my gosh, that's pretty good. You got your head back there. All right.
Wow. Yeah.
That's
like-
wow, look at that.
It's like every minute. it's
The
getting
rotation really improved.
better.
What kind of physician are you?
Yeah. Naturopathic.
Okay. And all of you don't mind if you're on YouTube, right? Okay, thanks. And everybody is impressed and pleased, correct?
Yes,
Yes.
definitely. Good job.
Okay, thank you. Well, actually, the good job
Yeah, I want her to
was
take a
this
picture of-
lady's. All right, so we know.
Stay there, we'll take a picture of her with you.
The neck was frozen before, and it doesn't feel like it's frozen anymore. Just a little bit right here, but
You've got much better rotation.
it
Do you
just
agree?
feels different. Yeah,
Okay.
it's awesome.
This is January 31st. We're at our training session. We're here with Dr. Meyers, who is a pediatric dentist. Any comments on what you saw today?
Well, I've been overwhelmingly enlightened. I've learned that so much more we can do to help even our patients in dentistry with many of the techniques, and so many of my relatives and friends have joint problems and arthritic problems, and I can see me helping those also. So,
Were you pleased with the results you saw instantaneously today?
absolutely.
Was it believable? I mean, would you have believed it before?
No, I wouldn't have believed it before. I believe a lot of good things about ozone. We've used it in dental procedures, but not to this extent. And I'm looking forward to further my education in ozone.
Thank you, and I may post this, yes?
Yes.
Thank you. This is Dr. Derives from Southern California. What were your thoughts on today's seminar?
Well, it was incredible. I had I saw a lot of stuff that impressed me, but the shots I got in my cervical spine, as you can see, my neck was locked up, and based on what I saw on YouTube, I expected some relief. I didn't expect this, so it far exceeded my expectations. The learning, everything here. Absolutely.
Thank you. Would you recommend it to other professionals?
I would, yes, sir.
Thank you. Tom, where are you from?
Boulder, Colorado.
And what do you do?
I'm a Master's of Oriental Medicine.
And what did you think of today?
This was actually an outstanding course for me. I mentioned earlier today that it connected a lot of dots for me. The practicality of the ozone modalities in practice, I think, are just starting. If you're thinking about getting into them, you certainly need to go see Dr. Rowan. He has got his head around this and is proficient at it, and I've been seeing amazing results all day.
Thank you. I may post this.
Absolutely.
Just did your shoulder a moment ago, right?
Right.
What happened?
Well, I have less pain and more better range of motion.
And we did your supraspinatus tendon, right?
Right.
Okay, and you have better range of motion already.
Right.
Okay, thanks. Dr. Karen Levy, medical doctor at our training seminar on January 31st, 2015. She's got a problem with her neck, and you've had a couple whiplashes, is that correct?
A couple of minor car accidents.
Okay, and let's see what happens. Bend your head back. That's really good. Bend it down. That's really good. The problem is rotation. Turn it to the right and turn it to the left. Limited, right there.
That's it.
It's stuck, right? Mm-hmm. All right. By the way, what do you think of what you've seen so far today?
Amazing. Amazing.
Would you recommend other doctors?
Yes, I
Was it
would.
worth it to come?
Yes, absolutely. Absolutely.
Thanks. We're going to go ahead and do your neck, and actually, we're going to have one of the trainees do it. You're okay with that, right?
Yes.
Great.
Yes.
Karen just had her neck done by one of our attendees, and now we need to see what happened, okay?
You want to go right to the left?
Turn your head to the right. Turn your head to the left.
More.
More.
That better? More better, good.
What'd you say?
About 20%, 25% improvement
More.
right there. Yeah, more better.
I think you said wow. Is that right?
Exactly.
You were
That's a
impressed.
wow.
Okay.
Look at that.
Very good,
I'm
very
looking. I'm looking back now. That's good.
What do you think?
Awesome.
That's even better too. All right,
Very good.
gentlemen.
Excellent.
What do you guys think of what you're just seeing?
Good job. Good job. Good result.
Tremendous traction on the left side.
Thank you,
Look at that.
It will be like new.
That's awesome.
Karen. Are you, awesome.
Yeah.
Are
Awesome.
you pleased?
Very pleased.
And that wasn't even done by me. That was done by this man who is the new expert. So we're going to be doing this, okay? Thank you.
You're welcome.
Thank you.
You're welcome.
Patel, a medical doctor who came from Texas, Dallas, Texas. How many times have you been here?
This is my fourth time I come here.
Why do you keep coming?
Well, every time I come here, I learn, and I think this visit really I learned a lot. And I think I'm more confident even treating a lot of patients now. I've been doing it, but now I really have a good confidence.
Worth it every time.
It's worth it, yes, it's worth it. It's well worth.
Thank you. Seminar, we have another participant who'd like to say what he saw. Please tell who you are and where you're from.
I'm Dr. Michael Karlfeldt. I'm a naturopathic doctor out in Boise, Idaho, and I'm just extremely grateful that this workshop is being held. It's extremely practical knowledge, it's hands-on, and it's something where you don't have all these extra information. It's very targeted as to what you need to use in your practice, and you feel like after this workshop you can go home and get going and start utilizing these techniques immediately, and there's amazing results that you see right in front of your eyes. So thank you very much, Dr. Rowan.
Were you surprised at the results you saw in front of your eyes?
I'm really surprised. It's amazing, and just knowing the amount of different infectious agents that can be then in joints, and then having then the ozone in there, get rid of the biofilms and clear all that up, and then have that amazing result just within a minute.
What about the joints and the range of motions?
Yeah, it was incredible. You see the impact that it had just within a minute. You know, the joint was stuck, and then after just a minute, you know, they had full range of motion. That's incredible.
Thank you so much. I may post this, yes?
Absolutely.
I just wanted to say thank you, and you're an awesome teacher. You have so much patience, and you're so giving, and I really, really appreciate that. Many, many blessings, and many people will benefit. Okay, bye-bye.